Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bayo.
Claim your life.
Picture this. You're 28 and recently married. Everyone keeps asking, when are you having kids? You have no idea when you should start trying, what warning signs to watch for, or what's normal versus concerning. You realize you know more about your car's maintenance schedule than your own reproductive system. Today's guest is a fertility specialist who's helping millions understand what they should have learned years ago about their own bodies. If you are new here and you've landed on this episode, I'm Dr. Bayo, your health advocate and a board-certified family medicine physician in Nevada. I bring the work I do as a doctor with me on the news, on social media, and here on this podcast. I'm excited to bring you this episode because at the end of this conversation, you'll have the knowledge to understand your own body better, recognize which lifestyle changes are worth your time, and gain tips to navigate the healthcare system for fertility care. Today, I'm joined by Dr. Lora Shahine, a double board certified reproductive endocrinologist and OBGYN based in Seattle. Dr. Shahine reaches millions monthly through her social media content and hosts the Brave and Curious podcast, a space for open, honest conversations about science, emotions, and decisions that shape our reproductive journeys. Dr. Shahine, welcome to the show.
Oh my gosh, what an amazing intro, Dr. Bayo. I'm excited to listen to what we're going to talk about. You're so kind.
Well, I'm excited. We've already just developed this amazing friendship. And the beautiful thing was it was through navigating some challenges that we both were having at the same time. So I love it. Let's kick off this show with some rapid fire questions. Are you game for it?
Ready.
Okay, let's do it. What is reproductive endocrinology and what made you specialize in it?
Yes, it is studying female hormones. And it's everything from puberty through regular and irregular menstrual cycles, some specific hormone issues like PCOS or polycystic ovarian syndrome, endometriosis. And the field is really focused on fertility. And, you know, over my 20-year career, like the last 10 years, it's really about family building, treatments like egg freezing, intrauterine inseminations, IVF. So it's really and menopause. We should be menopause specialists. And so we really learn about all of these things. Oh, and first trimester pregnancy stuff, which is the most common timing of miscarriage. So we learn about all of these things. And then a lot of us end up focusing on family building and fertility treatment, but we really have that background knowledge in a lot of things. And I came to it not really a direct line. I didn't have anybody in my family that was in medicine, like a doctor or nurse. I just knew that I wanted to be a doctor. I loved everything in medical school. I really wanted to do women's health. I love surgery. My last rotation in third year was OBGYN. I was like, this is it. This is everything. It's like surgery and women's health. And they made a specialty for me. And I loved that for 4 years at UCSF in San Francisco. And then I got introduced to this whole field of IVF and fertility, and I was just enthralled. I mean, I finished residency in 2002, so it's a long time ago. And I just saw that the field was rapidly changing, incredible technology. I knew I would never stop learning. And I'm very fortunate that I was able to see this path, and I would never look back.
I love that you said they made a specialty for me. Like, that's when you know, that touched my heart. So I love that. And that's exactly how I feel about family medicine. I'm like, yep, this is me. This is spot on. Okay, next, coffee order of choice.
Oh, a grande Americano with a splash of heavy cream.
Can you tell me why?
Well, I really love coffee. I don't want a ton of sugar. And it's always piping hot. So it's not like a drip. And it's sort of my go-to. I get it almost every time I go. And then if it's hot and I'm feeling like, I don't know, like I want something refreshing, I'll get maybe like one of those shaken oat milk lattes at Starbucks. I'm in Seattle, so I have to say Starbucks. It's pretty common around here.
It hits the spot. I love it. Okay.
Yeah.
One fertility myth you wish would disappear forever.
That AMH is a fertility test. and it's anti-Müllerian hormone. It's a blood test, and people use it all the time as like a first line trying to predict someone's fertility. And it's an important test. I'm not saying don't do it, but it doesn't give us the information that we want it to.
One lesson you're sharing with your kids.
Oh my gosh, don't be afraid to change your mind. I feel
love
like we got so like on the track in medicine, it's like, oh, I got to be pre-med, and then I got to do medical school, and then I got to stick with whatever residency I choose. And I had a pretty straight shot. I didn't pivot a lot, but I really admired some people that did pivot and have the courage to do so. And I think it's really trying to make the best choice that's in front of you when you're trying to figure things out, but don't be afraid to change your mind and pivot if it's not the right way to go.
I just want to highlight you are helping your kids have that courage to do so, because it's all about planting that seed. When someone can say it's okay to change paths, that you don't have to be strict, that's exactly what you're doing, because I believe those seeds are planted, and that does help those that we see go on different paths. There's someone there who's supported them or inspired them that you don't have to go down one path.
Yeah.
So I love that. Next one is best thing to say to someone struggling with fertility.
I'm so sorry. That sounds really hard, and I'm here for you.
Oh,
No advice, no comparison to your own journey or other people's journey. Just shut up and listen.
that's powerful. If you could teach one thing about periods that schools don't cover, what would it be?
It's pretty common in your teenage years to have unpredictable, slightly irregular cycles as your body's figuring out the hormonal communication. And don't be afraid to ask questions and learn. If you're not having regular cycles, you're having painful periods, really learn how to advocate. I know that I should answer this concisely, but I just feel like so many people are not taught what is, in air quotes, normal and abnormal. And there's a real pushback in medicine to just be like, oh, well, just take a birth control pill. It's okay to ask questions and try to figure out what's going on with your body. And it's really hard to do that as a teenage girl. So in enlisting an advocate, whether it's a mom or a guardian or an aunt that could go to the appointment with you and help you navigate this, I think just getting allies and asking questions and advocating, that's really, really hard. But just, it's okay to have slightly irregular cycles. But if things aren't normal, or what, and normal is a tough word, just ask questions and try to get answers, and don't be afraid to get a second opinion.
Most underrated factor that affects fertility?
Men. Up to 50% of the time, there's a sperm factor as a part of the whole equation in a couple that's trying to conceive. So get the semen analysis.
I love that. I have a friend who is navigating fertility, and she is a big proponent of really understanding both parties, because often it's just thought of like one person, one gender. And so I'm going to send that snippet that you just said to her, because I know she will appreciate that. All right, let's get into it. My first question to you is, what made you start educating people about fertility and reproductive health?
Yeah, I realized that I love teaching and I love my patients understanding their bodies and what's going on, and that I could not get all of the information I wanted to people to understand in even a 30-minute or 60-minute visit. And I wanted people to understand why and understand what tests we're doing. And it really started with, I have treated a lot of patients with recurrent miscarriage, and that's one of the most understudied, misunderstood problems that we're dealing with when we're trying to have our family. And so I actually wrote a book on miscarriage, Not Broken, an approachable guide to miscarriage and recurrent pregnancy loss. And I self-published it in order to be able to print it very inexpensively so that I could give it to patients. And this was back in like 2016 or 2017. So I really wrote a resource and not an ebook. Like it's, it's a book. And when you self-publish through Amazon, you can order copies, author copies, really inexpensive. So I just give it out to everyone. So it started like that. And then I wrote a book with an acupuncturist on fertility, like Eastern and Western approaches to fertility care. And then I just realized people weren't reading anymore. And it turned into a website with a blog. And then it turned into Instagram and TikTok and YouTube and podcasts. I love educating, but that's the core, is that I know when I go to a doctor's visit, I cannot absorb everything that they're saying. And fertility is not only complicated and confusing, it's also a very vulnerable place to be. So you just cannot absorb everything. But I think people are smart and they should understand what's going on with their body, and they should be able to understand why we're doing each test. And so that's where it comes from, educating.
All of those, I mean, when you talk about fertility, reproductive health, it is complex and it can be very difficult just to absorb. And so that leads me into, what are some of the things that people aren't often taught?
So many things. So basically, in health class in middle school or high school, we're taught it is so easy to get pregnant that we're terrified about conceiving before we're actually ready to have a baby. And then contraception works really well. Like, you can be in control of your contraception with almost 99% accuracy. If you don't want to get pregnant, you can prevent it very, very well. And then oftentimes when people stop contracepting because they're ready to start their family and it doesn't happen right away like they thought in health class, there's so much catch up that has to happen with sort of understanding what a regular cycle is, when you ovulate, what timing in your cycle it's a great time to try to conceive, when to seek testing. And I mean, of course, there are some people that do conceive their first month off of birth control, or those people that say, oh, I just look at my partner and I get pregnant. Well, they talk the loudest, but it's 1 in 6 couples that are trying to conceive that are suffering with infertility. And because we're not taught, we're lulled into thinking that we're in complete control of our fertility because contraception works so well. And in media, up until social media recently, it was just like you see a movie, somebody surprises their partner with a positive pregnancy test, and then the next scene in the movie is this beautiful baby. And there's a lot of other stuff that can happen in between. So really a lack of understanding about when to ask for help out of shame or not understanding or lack of education. And then on the flip side, even when you're in your peak fertility, both partners are in their like mid-20s, the chance of getting pregnant with one cycle, one egg, one sperm, and getting pregnant and having a baby is about 20 or 25%. So then it is actually okay if you're trying for a few months. Like, you don't have to panic if you don't get pregnant the first time you try. So there's got to be that balance between educating and understanding and not being fearful.
Let's imagine this couple who is listening to us right now and they are getting ready to conceive. What are some of the lifestyle choices that they could make right now? I mean, you talk about how there is this notion of health class and all of a sudden you think that it should happen. So what are some of the things we can control in respect to our lifestyle to conceive?
Oh, that's great. I mean, I think you can focus on your overall health and well-being because that's only going to help your reproductive health. If you are planning to try in a perfect world for even 3 to 6 months before you try, I mean, I'm not saying that you have to do this, but like if you have habits that you know that are not good for eggs and sperm or pregnancy, like vaping, tobacco, regular kind of heavy marijuana use, drinking on a really regular heavy basis, like there's some habits that you really should stop or at least decrease as much as possible, not eliminating joy, but within reason. And focusing on health, like thinking about the 4 pillars, it's like nutrition, exercise, sleep, and stress management. All of those things are really important. This sounds really funny, but I actually think that struggling a little bit with infertility, not too much because it's a horrible place to be. I don't want everybody to do it, but it actually wakens people up to realize, like in a younger time in life, like before they develop like the hypertension and the diabetes and stuff, that they start to realize like, oh, my nutrition and what I'm eating really does affect my sperm counts. And it kind of helps people get more in tune and live a little bit of a healthier lifestyle. I never would wish infertility on anyone, but that's actually a positive thing that can sometimes come out of it, because also you can't just assume that you can do whatever you want to your body and, eat fast food every single day and smoke like 2 packs of cigarettes, and that IVF is just going to be a miracle and give you a baby. Even if you are trying to conceive anyway, with assistance, without assistance, being healthy, thinking about good and bad habits, those are heavily emotional words. I mean, like pro-healthy or not so good for us habits is only going to help you conceive no matter how you're doing it.
Right. Looking at what you can control to
Yes.
help you conceive is very empowering. And it leads me to one thing that we can't control, because as we get older, we are aging. And I would love to know, what are your thoughts on truth versus the fear-driven narrative that we continue to hear when it comes to as you get older and your fertility?
Yeah, I would love to teach as a way to answering that question, because you can say it in a lot of different ways. Like you could say, oh, well, yeah, half of your eggs aren't going to work very well after the age of 35. Or, the miscarriage rate when we're 25 is 25% after every positive pregnancy test. And by the time you're 40, it's 50%. Like you could throw out these like really scary numbers, but let's just talk about what's really going on, because there is an age factor with sperm. It's more highlighted with eggs, and it's not anybody's fault. It's just biology. So women are born with the same eggs they're going to have their whole life. They're frozen in a genetic state in our mom's womb. All of our genetics are in these things called chromosomes. Chromosomes are those X's that we learned about in biology, and it's like a genetic code, and all the genetic information is on it. When we're born, our eggs are frozen, and they've got 2 copies of each chromosome. One came from the egg that we came from, and the other came from the sperm that we came from. And they're frozen like that. And it's when you ovulate, whether you're 25 or 45, that the eggs have to do all of their very delicate and important genetic work. That means they have to get rid of half of the chromosomes in order to fertilize with sperm that then gives the other half of the chromosomes. So just like every cell in our body doesn't work as well in our 40s as it did when we were in our 20s, more eggs make mistakes as the eggs age. This does not mean that somebody at 45 can't ovulate a beautiful egg, get pregnant, and have a gorgeous baby. That can absolutely happen. But we all kind of know, wow, that's pretty amazing. And we're asking like, gosh, did they do IVF? Or like, how did that happen? Because it's like, whoa, that's really amazing. Where someone gets pregnant, without assistance at 25, we're like, yeah, whatever. Of course they did. And if you think about it, when we're trying to conceive, let's say we are trying for a year, that's only 12 eggs that we're dealing with. And so percentage-wise, and we know this from studying embryos and genetic content and all that kind of stuff, when we're in our 20s, about 80% of our eggs do all that genetic work correctly. By the time we're 35, it's about half. And then over age 38, there's a little bit of a tipping point where 80% of the embryos that somebody makes when the eggs are 38 years or older are going to be abnormal. And an abnormal chromosome embryo, and sperm can still make mistakes too, but it's a lot of the eggs a lot of the times. If an embryo has an imbalance of chromosomes, it's either just not going to implant, so you're not going to get pregnant that month, or that's the number one cause of first trimester miscarriage. So it's not just getting pregnant, it's getting pregnant and having a baby. That really changes over time. And there is an age factor of sperm. Guys are not off the hook. It's just that sperm is made every single day. So it doesn't have that like I'm in the body for 40 years. And so many sperm that are made, and the egg is so selective, and we're able to kind of really be choosy about which sperm you're going to let in, then oftentimes a good sperm gets in. And then the age factor, like, yes, DNA fragmentation goes up, miscarriage rate goes up, all that kind of stuff with men, but it doesn't usually start until after the age of 50, maybe kind of starting after age 45. And it's just not as strong as an age limitation as with eggs. So I know I just spoke for a really long time, but this stuff is not just like a fact you can throw out. It's like a why. Because who is done just reading Instagram posts that are like, oh, you're 35 years old, it's going to be a geriatric pregnancy, or like your fertility is like a cliff. And it's not that, it's just statistics. And, I see someone at 40 and they've been trying for a year, I'm like, well, honestly, probably only 2 to 4 of those eggs that you ovulated in the year before you came to see me actually were good eggs. And in those cycles, maybe it was a bum sperm, or maybe the egg never got into the fallopian tube. Like there's just so many things that have to go right that when you're statistically dealing with a lower number of eggs that can do that genetic work, it makes sense that it takes longer.
Well, and just understanding how ovulation works, just understanding the number of eggs that you have, and that men are constantly producing sperm. And then there's this selection process that is very delicate. And if anything disrupts it, anything in your lifestyle, anything with your age, it can make it even harder. And in this day and age, we talked about how we're scrolling on Instagram, TikTok. It can be very triggering when you see, oh, if you're at a certain age, it may decrease your chance, which brings me to there's a lot of noise online right now about cycles and tracking your cycles and hormone birth control. Tell me what your thoughts are on which method do you find the best when it comes to tracking your cycles?
Oh, yeah. I think it's so important to be able to track your cycles. This is not something that I really learned or understood really well for myself, but it is so important to understand that a regular, predictable monthly menstrual cycle really is absolutely amazing and a sign of health. Like, it is amazing that your pituitary gland is making these hormones to talk to your ovary that then is talking to the uterus, and they're all talking back to each other in this delicate feedback loop where you once a month, if you are not pregnant, you have a shedding of the lining or a period. So something that's really important is if you're not, and it's okay to have a little variation, like less than 20% of women actually have a 28-day menstrual cycle. We just talk about that all the time because it's easy on a calendar with 4 weeks and 7 days, but if it's pretty monthly, like it's okay if it's 27 days and the next month it's 30 and the next month it's 29, but it's pretty monthly. That is such a good indication that you are ovulating. Because if you aren't ovulating, you're not going to get that signal. You're not going to get a pretty regular bleed. And that's a really great reason to see a fertility doctor or your OBGYN fast. You do not have to try for a year with irregular cycles and like never getting a period. You should go see someone ASAP if you're finding that. And so honestly, just tracking on a paper calendar is like a really good way to kind of know that you're at least having pretty predictable cycles. I know that there are apps out there. There's so many to choose from. I don't have a favorite. I am wary of apps selling information. So I think you have to be really careful. And I don't have a recommendation based on that because I know that that's happening. I do worry about apps that are like telling you when to try to conceive because a lot of them will just say, oh, everybody has a 28-day cycle. We're all ovulating in the middle, which is day 14. So if someone puts in that they had a period on this day, I'm just going to send them a notification to try on day 14. But for someone who typically has, let's say, 24-day cycles, they're probably ovulating on day 10. And so they're going to be missing the window to try to fertilize if they're relying too much on an app. Other ways that you can do it are basal body temperature taking. So that's where, it's labor intensive, but you can do that sometimes with Aura rings too. But the traditional way is actually taking your temperature every single morning before you get out of bed. Like you have to remember before you even sit up. And it's basically after you ovulate, your body starts making progesterone, and progesterone increases your basal body temperature by about a degree. The really important thing to understand about that is by the time you see that temperature shift go up, you've already ovulated. It's too late to really try to time intercourse. So it's a great way to track and sort of figure out when you're ovulating, get that feedback that you are ovulating, but you shouldn't wait for that bump in order to start trying. Ovulation predictor kits work well for some people, not well for others, but that's where you're just peeing on a stick and looking for the signal. It's called luteinizing hormone that the pituitary gland pumps out about 36 hours before the ovary releases the egg. So that takes like peeing on a stick every day for maybe like a week around ovulation. So those are the different ways. And I think that it is really important to start tracking. I think it would be great for people to do that as they're getting ready to start to try to conceive or when they are starting to try. But please remember that the bleeds that you get while you're taking birth control pills have nothing to do with your hormones communicating or your ovaries working. And so that's really common for people to come to me and say, and I'm like just trying to get a menstrual cycle history. And they're like, oh yeah, I've always had regular periods and still until I started trying. And I'm like, okay, red flag. What does that mean to you? And it's like, oh, well, I took birth control pills for 10 years. I always had a 28-day cycle. And then I stopped my pill in order to try to conceive. And now, I'm not getting regular cycles. I'm like, okay, well, the pills might have been masking something like PCOS or ovulation issues. And so I'm glad that we figured that out. So just remember, if you're taking birth control pills, it is a bleed, but it's not that your hormones are communicating.
A lot of people don't know that. I mean,
Yeah.
there's this thought that, oh, I am having a period and my periods are normal. And I love that you highlighted that, as well as sharing some of the benefits and also the kind of not so great benefits when you talk about the apps and how they go off like a 28-day cycle, which we're all different, and individual personalized medicine is what really should happen. And that leads me to, okay, the person that's listening right now is like doing those check boxes, lifestyle choices. We now have elevated, if you are of an older or mature is what I like to call it, woman who wants to conceive. And now you're like, okay, I need to make that step to find a fertility doctor. And often it can be challenging because there's barriers because insurance doesn't always cover it. So what options do you have if this is what you want to do to navigate the financial challenges?
Oh, yes. Well, it's good to double check because a lot of states will mandate testing at a minimum. A lot of insurance will cover, again, the fertility testing and evaluation. They just might stop when it comes to covering treatment if someone needs to do IUI or IVF. So be really clear. Don't make assumptions. A great resource is resolve.org. It's a nonprofit, patient-run website with a lot of information on advocacy for fertility and coverage. And they have a really good page that you can go by state, what is going on in your state. So that can be helpful. And then, of course, benefits can differ by insurance companies, of course. But when I was this might not be accurate right now, but when I was practicing in California, the state of California mandated testing. Sometimes patients would say, oh, I called my insurance and they said it wouldn't cover the testing. I'm like, actually, that's not true. And let's call back and we'll figure it out. So, don't just take no for an answer, ask a bunch of questions and talk to HR, that type of thing. And I feel like in that beginning where you're thinking about, should I do testing? It's really normal to be scared. Like you could be scared that they're going to find something wrong. You could be scared that they're not going to find anything wrong. I think that depending on a lot of things, I would love for people to go to a reproductive endocrinologist like me as soon as possible. But that's not an option for everyone, like location wise or coverage or things. But at a minimum, your family medicine doctor or your OBGYN should be able to at least start a semen analysis, some basic hormones, like getting a pelvic ultrasound just to make sure that there's not like cysts on the ovaries or fibroids that could be affecting fertility. And then usually they can get a HSG ordered, like a hysterosalpingogram, that is the flushing of the fallopian tubes to make sure that they're open. Most primary doctors should be able to do those basic tests, but just not taking too long to see a reproductive endocrinologist. And I know that's really personal for a lot of people, but I will say a lot of times people will say, I really wish I'd come to see you sooner.
Just being able to share that resource that you did is going to be a lifeline for so many listeners right now. And I love that. And I will share that personally as well within my clinic. Here's a reality check. About 9% of men and 11% of women in the US have experienced fertility problems. Knowing this, how we can start breaking down the stigma and silence around infertility so more people feel comfortable seeking help. My next question is, egg freezing is becoming more common. Who should consider it and what does the process look like?
Absolutely. I think egg freezing is amazing. I've definitely seen it become available during my 20-year career. I remember when it was just a whisper of like, oh my gosh, wouldn't this be amazing? Like, we can freeze sperm. Wouldn't it be amazing if we could freeze eggs? And then I remember when it was sort of experimental. So I was at Stanford doing fellowship, 2006 to 2009, and we were doing it, but like just on cancer patients because we didn't have a lot of long-term data. And when you're doing radiation, you're doing chemotherapy, you could really be losing your fertility. Like those, you might not get your periods back or ovulate again afterwards. So there was a risk like, well, let's freeze them, but we don't really know what's going to happen in the future. And then I remember when the American Society of Reproductive Medicine lifted the experimental label of it in 2012. And I remember the cocktail egg freezing parties of like, yeah, I'm hip and there's, you're in New York and you're freezing your eggs and it's so empowering. And then people are like, oh my gosh, this is the new birth control. This is like the ultimate control of your fertility. And I was like, oh, it's not an insurance policy, so I'm just sort of sharing a little bit of the evolution of it. And even though it feels like everyone's doing it, it's like, oh my God, like you should just freeze your eggs. I mean, it's still not that common. We're definitely doing more IVF and creating embryos and helping people build families than egg freezing. But it is absolutely incredible for anyone that is not ready to start their family now and they realize this age impact of eggs, that whole chromosome stuff and like all those numbers that I talked about, like, oh, at 40, you have a positive pregnancy test, there's a 50% chance of miscarriage. Like if you get pregnant at 40 with an embryo that was created from a 30-year-old egg, your miscarriage rate is 25%. And with a lot of other bells and whistles, it can be even lower with technology. But the way I think about it, in my career for the longest time, if someone really had a significant egg issue, whether it's from age and they tried IVF with their own eggs and it just never worked, or some people go through premature menopause, some people run out of eggs when they're in their 20s or 30s, the only option for the longest time in my career was egg donation, which is an amazing way to build a family. It's extremely common and people don't talk about it as much as they do like sperm donation or gestational surrogacy, but it's an amazing way to build a family. But it is, someone who, like the typical patient's like 42 to 45 or more, and they can't get pregnant with their own eggs. And so they're using eggs from an incredibly gracious person that donated them. And they're usually 25 years old. So those people who are getting pregnant, they're carrying a baby. That's amazing, but it's somebody else's egg. Again, it's an incredible way. But then now the way I think about it is you could freeze your eggs when you're younger. If you need them in the future, you could be donating to your future self. If you need them. It's a backup plan. It is incredible. And as far as like who should do it, oh my gosh, there's so many reasons, but you just, when you're trying to think like, well, what age, where's the cost effective analysis? Because if everyone freezes their eggs when they're 25 years old, because that's when the majority of the eggs are going to do all that they're doing, there's going to be a lot of people that are paying a lot of storage, never going to use them, probably not need them. And then if you wait until you're 40 and you're like, oh, wow, now I want to freeze my eggs because I'm not really sure when I'm going to want to start to build my family, you can absolutely do that. But so few of the eggs are going to work in the future. You have to freeze like maybe 35, 50, 60 eggs. I mean, just like, because you just never know. So it could be a lot of egg retrievals. So I'm really going off on a tangent. I should shorten my answers, but there's just so much to think about. Like, of course, it could be by age. It could be by if someone has a diagnosis of endometriosis, for example, that can absolutely get worse over time. Somebody who has that diagnosis might want to freeze their eggs when they're younger. Lots of other health issues, but it's something that I hope everyone has the ability to think about. It's just access to care is limited.
I'm glad you broke it down. When we hear about freezing your eggs From what I heard in that conversation, and this is a personal too as well, because IVF is personal to me, is really thinking about the number of eggs that you have, because that one egg that was frozen for 10, 15 years, if you don't have more than one, it may fail, even though it was, primed at 25 age or 25 or 30. So I love that you focused on that, because that's not often talked about. The other thing that isn't often discussed is the journey of, let's say you have decided to go into IVF, and what should you expect? I would love for you to highlight that piece as
Oh,
well.
sure. Absolutely. I mean, there's lots of different ways to think about it. I think of IVF as honestly like adding a part-time job to an already busy life, right? Because we're expecting people who typically already have full lives to be a patient, a nurse, a accountant, a pharmacist, a project manager, and fit all this education and staying on hold with pharmacies to get the meds. I could just talk about the medical piece and be like, yeah, for 2 weeks, you're taking medication and we see you in the clinic about 3 or 4 times, and then you have an egg retrieval and you're done, and I could just label it like that. But it's so much more than that. And on top of the emotional piece and is this going to work and what's going to happen? And did I do that shot right? It's a lot. I would say if someone said, hey, I want to do egg freezing, or I really want to do an IVF cycle, I'd say, well, take about a month for the preparation. That could be learning about it, figuring out where the meds are going to come from, speaking to the doctor, getting to know your nurse, getting pre-authorization. If you're fortunate enough to have insurance coverage, that takes time. And then think about that second month of like, oh, you're actually doing the process to get to the egg retrieval.
It is a full-time job. I love how you share that, because there is so much that goes into it, and you are really setting your own calendar and schedule for everything. That leads to this next question, because we all want the positive outcomes to happen. But I think we also have to set up our expectations for what could happen, and that's miscarriages. So we know it can happen up to 20% of pregnancies, but it isn't often discussed openly. What can people listening right now, what should they understand when it comes to pregnancy loss, and how we can better support people through this experience?
Yeah, I think that people have got to know how common it is, because again, we're under this assumption that we're in complete control of our fertility. And again, in the movies, positive pregnancy test, next scene is baby. And we're getting better about this, I think, on social media, but we don't typically share when we have miscarriages, that we don't realize how many of our people in our circle have had miscarriages because they didn't share. It's really hard to share both, I was pregnant, oh, and by the way, I had a miscarriage. So a lot of people are really suffering alone. And that even comes from, like I was taught, oh, well, if a patient asks, tell them not to share their pregnancy until after 12 or 13 weeks, like get through the first trimester and then they can tell everybody. Why? Because it's uncomfortable for other people to hear that you had a miscarriage. Like that's like when you need people the most. And I really want people to understand that the most common cause of miscarriage is absolutely something in the embryo, not something that the person did wrong. Like we need to even change the freaking word. Miscarry, like mistake. You did something and you didn't carry the pregnancy correctly, you as the person that was pregnant. It should just be like, yeah, pregnancy didn't continue. If you're able to test the tissue, it's like 60 to 80% of the time, you will find it's a chromosome issue. So back to that age thing, and this is why people have more miscarriages as the eggs and sperm age. We have an extra number 7 chromosome, like you can get to 8 weeks and then your body will figure it out. Your body's actually working. I mean, it's painful and it's awful. I don't want anyone to ever go through a miscarriage, but you can have all of those first things like fertilization and implantation in the first weeks of development, but it will stop at one point. And that's not the person's fault. It's not a glass of wine that you had before you knew you were pregnant. It's not intercourse. Male partners are sometimes worried that they caused a miscarriage from being intimate with their partner. It's not a long walk that you took. It was at fertilization that egg and sperm just didn't work. And That doesn't mean that we dismiss it and we're like, oh, just try again. Like if you have more than one miscarriage, you should ask questions. You should be able to get testing to figure out if there is anything. But the most common cause is something within the embryo. And I want that to be a hopeful message, because I think people who are having miscarriages also are going to have their family. Because think about all the things that are going right. You're ovulating. The egg and sperm like each other. Fertilization is happening. Implantation happened. Those are all huge steps. And if you could just get that right embryo, probably the next time you get pregnant, you're going to have a beautiful baby. But I know it's scary.
Those positive affirmations of what has happened is very powerful, and it also can help you just feel like, okay, there's some things that are happening that are right, even when I feel like I'm surrounded by a cloud of disappointment or negativity. And that's going to be really powerful for people to hold on to. So if you could change the way we educate people about reproductive health across the lifespan, what's the first thing you would include?
Ooh, never stop learning or asking questions, because I still think that we have a lot to learn about reproductive health. So don't make assumptions and keep learning. I would love for people to understand realistic chances of getting pregnant. It's like 20 to 25% in one cycle before the age of 35. Things that I talk about all the time, it's something like 60% of people will get pregnant in the first 3 cycles of trying if they have regular ovulation. 85% of people will get pregnant in the first year of trying. And so just kind of understanding how common miscarriage is not your fault. Let's keep the conversation going about menopause. And can we change that too? Because menopause has such a stigma. Can we just call it a low estrogen state? Like, what's going on with you? Yeah, I've got low E, man. So that's why I'm tired. That's why I can't sleep at night. That's why, I have frozen shoulder. That's why my ears itch. I mean, all these weird things that happen with low estrogen. God, we confuse ourselves so much with menopause. So, I could keep going. There's so much that we have to learn, but let's kind of start with the basics.
That's fantastic. I was like, yes, yes, yes. So any final advice on how people can better advocate for themselves in the healthcare system when it comes to fertility care?
Find someone that will listen to you and believe you. The time from onset of symptoms to a diagnosis of endometriosis on average is 7 to 8 years. And even women, are just taught oh, well, my whole family has painful periods that we don't go to work or we don't go to school for a couple of days every month. That's not normal, asking questions and finding someone that will listen to you, and don't be afraid to get a second opinion. And I know that's hard. It's hard to take time off of work. It's hard to have the courage to be like, gosh, there's such a power dynamic between doctor patient. And I do realize that I'm coming from a place where I am a doctor. So I feel comfortable asking those questions. And I know it's really hard as a patient, but believing in yourself, continuing to ask the questions. And then when you go to the doctor, really write down what you want to talk about, because it can be just so fast. They've got 10 minutes allotted. And you'd be like, hey, this is what I really wanted to talk to you about today. And it's sometimes okay for the doctor to say, okay, I can talk about one of those things. These other things are really important, but let's make another visit, because I don't want to just blow through this quickly with you. I think that's another disconnect that happens in medicine. And then another thing that I tell my whole family is when you go to a doctor, write down all your medications, write down your allergies, write down your surgeries, all these things that take 10 minutes to go over. If it's just written down, you get those 10 minutes of questions. So those are little things that I think are little tips.
There are little things that lead to a better patient encounter, better outcomes, and just better connection with your doctor.
Yeah.
And I call it, so I have my own, I call it the medical playbook. And I share with patients to do a symptom tracker, every time you see your doctor, write down, what they said, what your thoughts are. I endorse that as well. I think it's very powerful to have a book of your health information every time you see your doctor. But with all of that, the one thing that I love that you said, Dr. Shahine, was you have to find someone who will believe you. And that is something that needs to happen. If you are going to allow someone where you are putting your life in their hands, truly, in whatever you're going to take, whatever treatment, whatever test, they need to believe you because otherwise they can't do what they are supposed to do. So I love that. This has been a fantastic and empowering conversation. You've taken complex reproductive medicine and made it accessible. Thank you for bringing your wisdom and expertise to help everyone feel more confident navigating their reproductive health. For those who want to dive deeper into these topics, you can find Dr. Shahine across social media platforms where she shares evidence-based fertility information. And you can listen to her podcast, Brave and Curious, for more in-depth conversation about reproductive health. We'll have all the links in our show notes. Dr. Shahine, any final thoughts for our listeners?
Oh, no, I just really appreciate the opportunity to teach and connect with you. And I think we made some really important points about how to advocate for your care, finding people that will listen to you and partner with you on this medical journey. I think looking for a partner in a provider is a way to think about it as less of a doctor-patient relationship, but looking for that partner.
That partnership is vital. I love that. Did something in this episode click for you? Share it with someone who might need these insights too. This episode was packed with evidence-based information and practical guidance that will help you navigate fertility and reproductive health with confidence. Whether you're planning ahead or already on your fertility journey, you've got this. Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark.